Zaidi kama nilivyokuarifu kwamba kando na taarifa ambazo tunazokuletea, vile tunaangazia kinachoendelea katika baadhi ya matukio kupitia wanahabari wenzangu. Hivi sasa tuelekee kwenye mkutano unaoendelezwa hivi sasa na mwenyekiti wa baraza lile la magavana hapa nchini, akiangazia masuala tofauti ibuka na vile changamoto alizonazo hivi sasa. Zaidi wanazungumzia swala la afya.
Distinguished ladies and gentlemen, good morning. I have a written speech which I'll read very fast, and then I'll mention a few other things. It's a pleasure to have you here as we mark another milestone in the rollout of universal healthcare. Universal health coverage, UHC. The Constitution of Kenya bestows the county government with a mandate to oversee the management and provision of quality health services at primary and secondary level. Facilities Improvement Financing Act provides the full financial autonomy of health spending units, while the Social Health Insurance Act provides financing mechanisms for those spending units. The unit of delivery for health services in Kenya is the health facility. By this, I mean the facility and the catchment population. Indeed, we cannot talk about strengthening health systems when we don't strengthen health facilities. Ladies and gentlemen, for a long time, health has been delivered outside the defined and established governance structures. This has led to inefficiencies and weakened sustainability. The responsibility of managing and delivering healthcare is vested in the health facility in charge. The facility in charge must understand the internal and external environment to which the facility exists. We are alive to the fact that the ongoing UHC reforms have drastically redefined how healthcare is to be provided and introduced radical changes. We are also cognizant that hospitals are now being audited as independent spending units. This means those units must have systems and capacity to manage resources and deliver healthcare services to the people. To our valued partners, if your interventions are not centered around the spending unit, you may need to reevaluate the effectiveness of your investments. Ladies and gentlemen, this manual and the subsequent training will strengthen county health spending units by enhancing their leadership skills and accelerate positive governance in these facilities. These will position county health facilities as key executors of the UHC agenda under the bottom-up economic transformation agenda on health. To support UHC implementation, 43 out of the 47 counties have allowed funds generated by health facilities to be retained and used at facility level to defray services. All the 47 counties are also providing complementary health funding to health facilities, given that the FIF alone cannot fully cover facility needs. And the counties continue to engage PFM actors, public finance management actors at national and county levels to facilitate autonomy as envisaged under the Facilities Improvement Financing Act. Indeed, 2 months into the transition from NHIF to SHA, 5,300 public health facilities have been registered, licensed, and empaneled under SHA. Counties have contributed immensely to the registration of the 14.8 million members into SHA, thus providing them an opportunity to access tax-funded primary healthcare services. in level 2 and 3. Ladies and gentlemen, despite these bold steps, we're still faced with several transition challenges. One, the provider payment mechanism for PHC services is hazy, leading to increased out-of-pocket payments. Two, the proxy means testing used to determine the premiums for the informal sector has not lived up to expectation. And three, the core problems that inform the reform agenda, which is the mandatory payment for the informal sector, adverse selection, and emphasis on preventive rather than curative services, remains alive even under Shah. Distinguished ladies and gentlemen, special thanks to USAID, Propel, and other partners for working with us throughout this journey. I would like to conclude by reaffirming that counties are committed to providing practical solutions to ensure that UHC agenda succeeds. As we launch this manual that has already been piloted in Nyandarua, Lamu, and Meru counties, I call upon all stakeholders to join hands and extend its adoption and utilization across all the 47 counties. I thank you all. Just a couple of things. One, this is very important.
Ni mwenyekiti huyo wa baraza la magavana hapa nchini, Abdullahi Ahmed, ambaye pia ni gavana wa kaunti ya Wajir, akipeana hapo mwongozo wa uzinduzi wa mwongozo wa masuala ya afya katika kaunti, ambapo pia amegusia masuala kidogo ya ile bima ya afya ya jamii, namna ambavyo inavyoendelea kutekelezwa hususan katika vituo mbalimbali, akitaja kwamba zaidi ya vituo 5300 kaunti zote sasa zimeweza kuunganishwa na mfumo huu. Lakini licha ya mabadiliko ambayo yanaendelea, kwamba bado wanakabiliana na changamoto kadha wa kadha katika kutoa huduma za afya kupitia bima ya aina hii. Ni mkutano ambao unaoendelea katika afisi za baraza la magavana hapa jijini Nairobi, na bila shaka kwenye taarifa zetu za mchana utaelezewa kina ya kile ambacho kilichojiri. Tuendelee na taarifa zaidi. Hapa ni kwamba mshukiwa ambaye anayefahamika kwa jina la Elias Njeru Mutugi anadaiwa kumdunga mpenzi wake Florence Wanjiku mara 14 usiku wa Novemba 21, yani kumdunga visu, amekamatwa baada ya